my name's Andre Flock and I'm the Adolescent Exploitation and Missing Manager and the Contextual Safeguarding Lead for Achieving for Children, covering Richmond and Kingston local authorities. The purpose of the training today is to look at and understand identifying contextual safeguarding and exploitation, and then thinking through that and what that means so that we can determine the appropriate intervention. Contextual safeguarding was developed by Dr. Carleen Furman and the University of Bedfordshire, initially trying to understand peer-on-peer abuse. And as that work developed through the years, it has also come to look at what is called extrafamilial harm. And extrafamilial harm is that harm that happens outside of the family home by people who are typically not family members to a named child. And through time and the looking at and understanding extrafamilial harm, although that's a term that's more commonly associated today, we really started to understand what that looked like back in 2012 with the various serious case reviews in response to child sexual exploitation. And it was at that point that there was a recognition that it was important for children's services to respond to that harm that happens outside of the family home. More information can be found on the Contextual Safeguarding Network website, and I would strongly recommend that you sign up for the weekly to bi-weekly emails and newsletters providing access to additional information, current research projects, including training. Contextual safeguarding is important within AFC because it helps us to understand those children within the two boroughs who are at risk of extrafamilial harm. Generally speaking, we had an understanding in terms of children who were known to the missing or the MARV panels, but that was typically for children who were considered to be at a medium or high risk of exploitation. But we recognize that children are also vulnerable because of key indicators to exploitation, and we need to ensure that we're providing an intervention and a timely response early on to prevent further risk of exploitation. So by being able to understand those indicators, being able to work with children prior to them becoming at risk of harm, then we can hopefully help to safeguard them as we all understand safeguarding. And it's also about looking at and moving beyond just an understanding of adverse childhood experiences within the family environment to also understanding the impact of exploitation and how for many children that can be a traumatic event in and of itself. So by this process, we're able to understand from a more holistic perspective the child's journey and being able to intervene. Contextual safeguarding is simply a phrase of looking at the spaces and places within a community setting where the harm may occur. It's also a recognition that typically children in their adolescence are those that are more likely to be harmed outside of the family home due to the natural stages of their development and their peer groups, but also the time that they are more likely to spend outside of the family home. Throughout the training, and there may also be terms that you may become aware of, or through your day-to-day job you may have already been aware of, but just to provide some clarity in relation to the terminology used within Achieving for Children. The terminology on the right hand provides some clear snapshots in terms of different types of exploitation or harm that might happen outside of the family home that is used when thinking about that extra familial harm. So these are all the different types of harm that we could be referencing. Contextual safeguarding and exploitation is looking at both the spaces and places or locations where the harm happens, as well as the type of harm that happens. Then there are various types of meetings, and each of these meetings are really important in understanding what is needed and the purpose of that. So a MAP is just a multi-agency professionals meeting. A mapping meeting may be looking at and trying to understand the various types of harm or associates or persons that are known. So it's an understanding and looking at what's happening. Core group, child in need, your child looked after, those are the statutory social care. And then the contextual safeguarding complex strat is looking at multiple children or a specific location and trying to put in a child safeguarding approach within that context and for those for that group of children. When we are working with children, we often may not recognize that they are a victim of exploitation. And so it's really important that we understand the early signs. And it could be as simple as a change in behavior or a change in the way that the child dresses. It could be that there is a pattern to missing episodes. Are they missing school at the beginning of the day or the end of the day? Have they worn multiple layers due to concerns of concealing substances because they are aware that the police may only be able to do one layer of clothing check because of their guidance and their protocols? Or is it because they are being sexually exploited and they've been told to wear one outfit, but they know that they're not able to leave their home or attend school in that outfit, so they wear another outfit on top that would be more appropriate for them in the environment that they are initially going to or trying to leave? The impact of some of these signs could also be that they are missing their education, they're receiving multiple fixed term exclusions or have received a permanent exclusion, that they have some unmet health need, whether it's sexual, mental, or physical health, and that they may have also received some type of gift. That could be of a monetary figure, or it could be that they have been groomed into using substances and they report that they are getting, for instance, cannabis for free. These are all things that we need to be mindful and aware of in terms of indicators. There is also studies and research that indicate that if a child has been recruited into exploitation, what this could look like, again, concerns could be exclusions from school, because then there are periods of their day that are unaccounted for. Special educational needs may be that they don't understand the socio presentation of others or the physical presentation of others, or be able to read those social cues. There could be additional factors within the home that are those push and pull that could impact on them being exploited and groomed outside of the family home. Another thing to be mindful of is that for the children who are currently being discussed at MARV, this is the top 10 factors. And one of the things that's really important to note about this is that the highest indicator is a child who has low self-esteem, and the number 10 indicator is receiving goods or money as gifts. And what this means is that a lot of what can be unseen could actually be more of an indicator than that physical presence of something new. Before making a referral into children's services, there are a number of questions to be asking yourself as a professional, but also thinking about how and what is it that the child's actually saying to you. Another thing to be mindful of is that a child is anyone under the age of 18, and although many times children in their adolescence are spoken of as a young person, it's important that we recognize that they are children, because it will help us to think differently about the questions and about the information that's being provided. It's thinking about what intervention is needed for the child, so identifying that specific need, and thinking about how that can be supported within the service or agency that you work within. And then also thinking about how does that correlate to significant harm, and how is that evidenced? The evidence for exploitation and extrafamilial harm could be very different to thinking about that harm within the family home. If a child has been missing from education and there are clear patterns to that, that information would be really important to know. If a child that you're working with and you're aware of police involvement, what does that look like and what does that mean, and how can that then evidence the worries that you have for the child? It's also being sure that we are capturing what it is that the child is saying, or the person who's reporting the worries, and try to avoid any type of jargon or preconceived notions or any type of language that could be confused from one agency or professional to another. It's also really important that we get the family's perspective, because with extrafamilial harm, what we're saying is that that harm is happening outside of the family home. Is the family aware? Are parents aware of what's happening? Do they have their own concerns or worries about what's happening? How long have they had those worries for? And how does that correlate with the worries that you have? Is there more information that can be understood? Are they able to access support, or is there something that's preventing them from accessing any type of intervention? Do they feel afraid about talking through things or about sharing information? And how does that information from the family correspond with the initial worries that you have? And how does that then help you to identify the level of risk as well as the level of intervention that's needed? What we know from local learning reviews is that complicating factors for children who are at risk of exploitation and or who are reported missing, those children have additional needs related to their emotional well-being, their use of substances, and whether or not they have any diagnosed or undiagnosed needs. It's important that for children who are reported missing, that there is a plan amongst the professional network with police on identifying the locations where the child may attend, looking at key information, and then by having that, developing what's called a trigger plan. And that's the plan that police can then action when that child is reported missing to ensure their safe return, either to home or to their placement. It's also, again, thinking about any trauma and remembering that not all trauma that a child has experienced could lead to exploitation, but rather thinking about the experiences of a child that has been exploited or groomed through the lens of trauma. What does that experience mean? Have they been physically abused by their exploiter because they've been forced to go missing and then be responsible for being within a cuckooed address, which is simply an address that's been taken over by adults for the purposes of selling drugs or other means of exploitation, and that could be to adults as well as other children. It's also important that we think about the language that we use when we're talking about children who have been exploited. Legislation, policy, and procedures are all very clear that children should not be made complicit or responsible for the harm that they've suffered due to exploitation. It means that we're not labeling them within the criminal justice system or thinking of them as mini adults, making certain decisions that could be risky. It's about ensuring that we're not using language that has them perceived as promiscuous or lying or aggressive, and that we're rethinking what it means for that child to engage with a professional. It's really important that when we're identifying children who are at risk of exploitation, that we're understanding those push-pull factors and that we are describing what has happened rather than labeling that perceived behavior. So for instance, if a child is not willing to engage in a discussion or some type of intervention, is it because they're afraid that if they do work with someone, that they're going to be forced to make a disclosure or talk about what's happened, and they've already been threatened by the exploiter and said, if you talk about this, we will harm you or we will harm your family? What does it mean if a child provides different accounts to different professionals where there is an understanding from the child's perspective that actually those professionals are already in communication? Is it that they have shared different pieces of the information of what's actually happened to them in the hopes that professionals will speak, putting the different pieces of the puzzle together to recognize the greater picture of what's happened and then being able to intervene? Looking at it from this perspective helps us to understand some of the safety planning that that child has already innately put in place, rather than just labeling them as a liar or being manipulative because they've told professionals different things. For more guidance on this, there's also a link, and AFC have developed their own language guidance as a response to this to help us remember that children who are exploited are not complicit or responsible for that harm. In that same thought, it's important that we understand consent when a child is able to consent and when they're not able to consent. And an example has been provided here on the basis of a child who's been sexually exploited. According to the police, a child under the age of 13 is unable to consent to a sexual act. Therefore, if we're thinking about whether or not a 12 or 13, a child under the age of 13 is able to consent, we can say actually based on this, they're not. And therefore, our intervention will be focused in a perspective related to sexual abuse and reporting accordingly. If, however, they're over the age of 13, what we need to think about within that context is whether or not the child has been exploited. Because if there is evidence, even if the exploiter is a peer, so someone of the same age or slightly older, has used any type of force, threat, or coercion, if that's evidence, then it means that the child is not able to provide their consent. We need to then be thinking about the risk factors around exploitation. We can then be thinking about Gillett competency and Fraser guidelines. and what that means in terms of whether or not a young person has the ability to consent. So the way that we understand consent will determine the response we provide. So it's really important that we're not just seeing their age and thinking that they're competent, but really exploring and understanding it from that perspective, because it will help to ensure that we are able to intervene at the right level. What is also important to note is that just because a child has been assessed as being exploited doesn't mean that all of their consent has been taken away. So for instance, a child who is at risk of exploitation may still have the ability to consent to sexual health needs. So one form of consent does not negate the other type of consent. So it's really important that we don't consider a child unable to consent to all things, but likewise that if they are being exploited, that we don't make them complicit in that harm. Another aspect of contextual safeguarding is thinking about the location. And it's thinking about more holistically from a community perspective, what might need to be changed within the community setting to support safeguarding for all children. What is it around, for instance, a location like a park where harm is continually happening? What response might need to go into that park that supports all children? Or if there's a hallway or a stairwell connected to a particular building or a car park or a school or some other type of venue where that harm is happening, what can be done about that hallway or that stairwell that promotes safety for all, rather than just looking at and trying to identify the worries for one? Within AFC, we use the signs of safety approach. And when we're thinking about this in connection to contextual safeguarding and exploitation, there are some things that will help us in being able to unpick and better evidence the worries and the what's working well. What is it in terms of a strength that's been evidenced over time that can be used as a protective factor? What other worries might be complicating risk factors around exploitation? And what information may not be known, where there's a gap or a grey area where actually there might need to be a bit more information that's gathered, or actually highlighting that there's limited information in this area would help to determine the next steps, because then a response could be implemented within that grey area. When thinking about referring into children's services, there are a number of referrals that could be made for intervention, and also at what point it would be appropriate for a social worker to complete an assessment based on the identified worries. So your level 1 services like a youth worker or the youth substance misuse worker may be where there are indicators or vulnerabilities, but we haven't actually yet evidenced that a child is at risk of exploitation. Level 2 would be for Project X, which is an intervention that supports children who are at risk of serious youth violence and criminal exploitation. The CSE awareness group or unique talent. Each of these services can be referred to without a social worker being working with that child as well. Then your level 3 and your level 4 is where a social worker would also need to be involved due to identifying at this point that a child is at risk of or has actually been harmed because of the exploitation concerns. The varying referrals here could be to rescue and response in relation to county lines. This includes children who may be associated to other children who are at risk of county lines, and therefore they are vulnerable themselves. There is the national referral mechanism, and there is a statutory duty for children who are at risk of exploitation to be referred in, and this would be for the social worker to complete. Through Crying Sons, children can have access to the gangs worker to support in understanding what's happening, but also supporting that professional network in what's happening for the child. And then Phoenix Project is there to support children who are at risk of sexual exploitation. And the MARV panel then looks at all of the children who are considered to be at risk of medium or high, and therefore there would also be a social worker involved at that point. Any of the children who are known to the MARV panel may also be accessing one of the other interventions. So being aware of what interventions are on offer for the children within the two boroughs is important to note as well. When looking at referring into children's services, it's really important that there is specific explanation of those observations. What is it that has been seen or heard? What is it that could be smelt? Did a child come into school smelling of cannabis? Those things could be really important in understanding the worries. It's really important within this, again, to not use any jargon or slang, using quotes. So if a child uses slang, it's really important to use that, because when it may not be thought to mean something, could actually be an indicator of worry. And then providing a clear chronology. How many times is it that the child has been excluded? How many times has there been a worry around antisocial behavior? How far back does this go? How many missing episodes have there been? What does that pattern of missing education look like? Is it just before a school holiday or just after a long weekend? What services have already been considered? What interventions have already been put in place? And how effective was that? Were there any barriers that need to then be considered within that work? Also to note, my role as the contextual safeguarding lead, I also look to put within that a response to locations. So if you have any concerns around specific locations, please email the contextualsafeguarding.exploitation email address. Through that work, I also do and meet with colleagues around specific locations to think about our responses to ensure that all children within a community setting can be kept safe. We're in the process of developing pilots with a particular school, and also we'll be developing soon community champions. And community champion would simply look at developing a community-wide response and encouraging local professionals and individuals who are interested in relation to contextual safeguarding and exploitation and want to have a key role, how we can develop that community response further. And if you're interested, you can send me an email. Thank you for your time.